Support team, please start the live. In between, just I'm starting. Support team is going to present his slide on dashboard. So very good afternoon, all our respected doctor and participants. Myself, Anand Kumar Jha, Zonal Head from Kedla Pharmaceuticals Limited. Sir, thank you so much for joining us for today's webinar. We spread awareness about rabies, which is fatal disease, as you know all, but can be avoided once appropriately vaccinated. This is an initiative from Kedla Pharmaceuticals through its innovation to serve the society and humankind. Today's our topic is dose reduction strategy in rabies management and role of novel vaccines. Dear doctor, rabies is world first three-dose anti-rabies vaccines. Sir, rabies has successfully completed 1 year with more than 40,000 animal bite victims being vaccinated. Not only that, but also 100% compliances was recorded and no cause of any adverse effect. With this, it is my honor to introduce Dr. Yashwant Singh Pal. He is MD physician in Dehradun. He is associated with this last 20 years. He is practicing in 2-3 clinic, as well as he is associate professor in Subharti Hospital. Now I will request Dr. Yashwant Singh sir to start the session. This is from my side.
Thank you, sir. So, good evening, everyone. Myself, Dr. Yashwant Singh Pal. I'm practicing in Dehradun as well as in Subharti Medical College attached. As Mr. Jha is already told about me, thanks for Cadila to give me the opportunity to presentation rabies and effective treatment as well as prevention for the rabies. So, let's start our discussion. Rabies. First of all, what is rabies disease? I would like to cover all these disease, whether we know about the rabies disease, epidemiology, and the latest vaccine that Cadila has introduced to us. So first of all, what is rabies disease? I would like to share some already we know about this disease. So basically, rabies is a zoonotic disease. So disease, that means it is caused by the virus, and rabies is rabies virus. This virus basically encoded by several structured proteins, especially the N protein, that is nucleoprotein, P protein, that is phosphoprotein, matrix protein, as well as glycoprotein and and the virus RNA polymerase. So out of these, for us important is G protein as well as N protein, which gives the effectiveness and the presentation as well as clinically and the prevention for this disease. So if we talk about the epidemiology of this uh, disease, globally there are the WHO give us the data that rabies kills around 59,000 uh, effective the people in the throughout the world, and death are around as per data in from the 2018, that is 59,000. And if we talk about the India, it is almost 20,000 deaths per year, which gives the WHO gives the data that included 95% are the rabies cases are uh, effective by the dog bite. And this disease, as we know, that preventable, 100% preventable. And but if the symptoms appear, then definitely it's a fatal. And if symptom develop, fatal is almost 100%, but we can cure as a prevention as well as 99%. So WHO gave us the data about the epidemiology in the disease, that there are some effective uh, states where is the rabies is mostly occurs in, like Uttar Pradesh, that is around the 4,003, and the central east, southeast, and the Chhattisgarh, as well as the other states. And if we see the another data that provided by the WHO, there are some states like Lakshadweep, Jammu, there are a very less disease. But this disease, whatever the cause, is by the bite of dog only. But there are some various animal also, spinal, that causes the disease. The most common of these, the most common animals are the dog, cat, mongoose, as well as the other animals. So in our data, it is mostly the dog. So rabies, as I told you, that it is 100% fatal. If it is, there is associated with symptoms, and if we have taken the vaccine, that is 100% preventable. So we don't have to worry about this disease. So if we let's talk about some evolution of the rabies vaccine. So first of all, in 1885, there was developed first generation vaccine. Then there was developed second generation, then third generation. Today is a fourth generation vaccine they are developed. So in 1885, the vaccine, first of all, it was developed live attenuated vaccine, and it was developed basically in a neural tissue. But the drawback of this vaccine was that it has a several neurological disorders, even sometimes death. So the vaccine prepared in this era, it had various side effects, definitely. Then there was a second generation, and there was development of inactive vaccine, again non-viral. In comparison to the first one, the issue of adverse effect was less. If we see the study of the second generation vaccine, but as well as the drawback was the compliance. Then the third generation as well as the fourth generation vaccine are developed, and then there was developed from the cell cultures, then inactivated vaccines, and today nowadays the Cadila has introduced ourselves is fourth generation vaccine through the VLP technology. So we will discuss about these disease this vaccine which nowadays introduced. Basically, in this vaccine, the technology used, or we can say it was developed by the recombinant DNA technologies. So, whether the either DNA vaccine or the protein subunit which was developed. So, as we know that virus is encoded with a gene, especially the G and N protein is mainly for the concentration for the us. So this vaccine is vaccine like very virus like particles, and it was developed. So there was vaccine that was previously it was prepared by the neural tissue, then in cell cultures, and then there is inactivity vaccines are developed, which had basically old technology. The drawback is was inconsistent in potency, stability, and the short supply, and the adverse effect mainly the associated with cell cultures vaccines or old. Then there was another drawback with all these vaccines that there was a decreased compliance. So all these on the basis of all these factors, we collected the data that the majority of the, first of all, the previous vaccine has a side effects, which was even lead to the death. And then the another drawback was the compliance, which had the 4 to 5 injections. If we previously see the vaccine, rabies vaccine, like we can say the Rabipur, the most commonly used. So it is the schedule. If we see, then within the 90 days there are 5 doses: 0, 3, 7, 14, 28, and the data which we have collected. So on the basis of this, we can see that in these 5 injections, the compliance in a fourth and uh, fifth number of vaccine, or according to the fourth or fifth day schedule, the compliance was very less. Sometimes the person has not availability the vaccine. Sometimes the person is not able to reach the hospital. Sometimes the busy schedules, or sometimes the pain or other factors. So the compliance, it was a very low. Then we see all these factors, the as a medical person or professionals, we see the disease is not completely covered. Because if we see the vaccine, there should be a concentration around the 0.5 international unit per ml, which should be present after the bite, or we can say after the first dose, at least 14 days. So, but due to all these factors, the medical need, uh, which was a drawback for us to cover the disease, that was really upset. So now there was introduced a vaccine, that is novel vaccine, which has a VLP technology, virus like particle, nanoparticle technology. And the beauty of this vaccine is that the compliance, what we are getting uh, low. So in this vaccine, we had a great opportunity to complete the treatment. So it was introduced, the recombinant rabies G protein vaccine. The first protein, first of all, it was developed because the RNA recombinant DNA technology. So this was the first protein subunit vaccine prepared by the VLP platform technology, by the recombinant DNA technology. And the beauty of this vaccine, that it had only 3 doses. That means there are reduction of fourth and fifth dose as per in routine vaccines. But in this vaccine, the beauty is it fully covered by the 0, 3 and 7 days. That means the total doses, and as intramuscular, most commonly as I used in intramuscular in the arm, otherwise the not in intragluteal. So better compliance, better regimen, and again same the preparation. There is no need of reconstitution. It's ready to use immediately. So first of all, we see the about this technology. It is as we know that G protein is the important protein for us, as it is difficult to stabilize. And by this technology, we have isolated G protein, and then it was purified, and then there was a stabilization. Then these virus like particles, they again complexes exist as a nanoparticles, and they behave like a native particles in the body, and but don't contain the viral genome. So they don't replicate as they don't have a viral genome, but they can mimic the viral antigenicity without any being a pathogen. So they are capable to introduce a strong humoral as well as cellular immune response. And due to this factor, the there is basically they they don't replicate, so they don't mimic the viral antigenicity. So it has a strong humoral and cellular response. So as by the if we see the seroproduction about with this vaccine, and as we compare with the doses, like in a 2 doses and 3 doses, then the 10 microgram, if we have introduced the, we can see in the data that this is the seroconversion and present of a seroprotein in the during the days 1 up to the 14 days, right? On the 42 days, then on 90 days, then 180 days, and then the 270 days. So the study shows that the seroconversion level was a very high with the usage of this vaccine. Then uh, 3 doses regimen, as we have used even in my patient also, I have used 5 patients adult, even in children, and there was no side effect. So in beauty of this vaccine is less number of doses that lead to the high compliance. Number two, almost nil side effect can be given to adult as well as in kids. And the immunogenicity in the 3 doses of this recombinant technology G protein vaccine, it was very high as compared to the routine vaccine, that is Rabipur. So I would like to say that thanks for Cadila, that providing us a good regimen, good vaccine, and with a almost nil side effect, I can say, if I compare to the previous vaccines. So in if we compare for the first generation, second generation, third generation, fourth generation vaccines, so as in the first generation, it was too high side effects, but there was issue was the cost of the product. So it was very high. Then the second, which was generation vaccine, the cell vaccine introduced, then the difficulty was with that vaccine that it was a compliance. So it was a more regimen to cover the disease. So sometimes, as I told that the compliance due to low compliance, the person or patient has not fully covered with the vaccine. Now the Cadila, this introduced vaccine, so better is this. Cost is also I can understand, because there are 5 doses and it is around, if as I do with patient, around 300-400 rupees per vial. and on about in a 4 doses, it comes around 2,500. Whereas if I compare this RNA recombinant technology vaccine, that is G protein vaccine, named the rabies, it is cost around 650, 700 rupees, which has only 3 doses. So cost, if also we compare, then the previous vaccine, it is also low and compliance is more with a less side effect. So I would like to prefer this vaccine as due to the compliance. And if also we have seen the study about the efficacy of this vaccine, so even in the 14 days, the seroconversion level was very high, which was normal is zero point 0.5. And in this vaccine, it was very high, more than 0.55 per ml, which was presented in a 90, 140, and 270 days even. So the less side effects, seroconversion is better, cost is also economical, and this all these collectively, we see the result if we compare with the previous vaccine. So the slide shows the efficacy, safety of this product. So in efficacy, there was conversion, and it was more 99.24 percentage in comparison to the 97.72 percentage. And also, if we see the safety, or we can say the adverse effect, so we can see that rabies has a 9.9, which was in comparison to the Rabipur. If we say it was 17.2, which was, we know already that according to the disease, as the WHO classified as the 3 categories, category 1, 2, 3. In category 1, there is only the intact category, WHO categorized as with the intact of skin. But when there is a grade 2 or grade 3 rabies, that is transdermal bite or bleeding, then definitely we have to consider this vaccine, because the adverse effect, especially the in a bleeding cases, it was a very less in 9 point, as we can show we can see the 9.9 in comparison over 17.2. Whether is the local adverse effect, we also see like a pain, itching, swelling, redness, erythema. All these are also were decreased around the 7.69 percentage in comparison of Revipur of 13.56 percentage. Also, the other like redness, swelling, they were also like 2.81 in comparison of Revipur 3.37 percentage, and swelling 0.75 as 1.7 percentage in the Revipur. The other like systemic, we can say fever, headache, urticaria. Also, we can see that it was a very less with the rabies vaccine, this RNA recombinant technology vaccine. So I uh, I can see that the rabies, by the study, it shows that it was a non-inferior to the reference vaccine, the preferable, which was preferred like Rabipur. So it was non-inferior. Another, the major thing for me, it is adverse effect. Sometimes the patient come to me that when I gave the first dose or the second dose on a third day, and when they come on a third day, they always complain that there is a present of erythema, nodule, pain. So it was a very less, as I used in around 5 patients in adult. Uh, I could not find out any even adverse effect. So these complaints also, if suppose there is some mild adverse reaction, so it is only for a 3 schedules program. So compliance is better, not in the 4th and 5th as well as it was present in the other report. So this was a novel, I can say, safe if I compare previous one, immunogenic, compliance, cost. So all due to all these factors, I uh, suggest that for if I see for my patients, so I would like to prefer this vaccine. Uh, this is all from my side. Thanks.
So, sir, thank you very much. One question is from audience side, sir. Uh, if they are using 5 dose vaccine, if we will start 3 dose vaccine, compliances is the challenge right now as per your slide. How you are looking?
Sorry, sir, pardon. I could not able to hear. Kindly repeat again.
The question is that I am using 5 dose vaccine, so I will put on 3 dose vaccine. How compliances will get the benefit to my patient? This is the question from audience side.
Okay, thank you. Sir, actually, see, there are a 5 dose regimen, right? So when the any patient, when comes in an acute condition immediately after the bite, so the fear treatment is level is consideration is high 100%, so immediately he whatever you suggest he will take the treatment. But as soon as the time passes, first doses, second doses, three doses, then sometimes the cost and sometimes the availability and sometimes the busyness of schedule, usually the fourth or fifth dose, usually the patient escape. So due to the escape, we are not satisfied as we have not provided the fully regimen because of the lack of availability of the patient itself or the drug itself. So in comparison to that, this vaccine has only 3 doses. So if we see the patient that it has only 3 doses, so he will be happy. So, okay, 3 doses. And the prepared vaccine intramuscular within a 5 minutes, you can provide.
Right, sir. Right, sir. Right, sir. Is there any your own clinical experience you can share? It would be valuable for all audience, sir.
So as per my own patients, I have introduced around 6 patient, adult patient and 2 kids. And as I have seen in the report that local swelling pain, it was comparatively more in that vaccine. And I would like to say the report like. So, but when I use this medication, the even only the itching I could found. No, there was no erythema even, no node. So patient also didn't complain to me that it causing, because usually I prescribe if some itching, so I give some anti-allergic also. But as in a first or two patient, I prescribed anti-allergic as well as I had habit to write an anti-allergic. But as I have seen, when the patients came back, I asked that, did you have any other complaints regarding this vaccine after the giving of this vaccine? But they didn't. So I didn't prescribe even anti-allergic on a third or fourth patient. And really it was no need. So I think so that even the less reaction, local reaction, if they are not present, so major I couldn't find out even single complaint.
So thank you very much, sir, for giving the valuable time with us, sir, as a speaker, sir. Really, you have touched all points, all slides. You have widely uh, gone through the all basic things, all expectation of the slides. You have conveyed to all participants. Sir, thank you very much
Thank
from
you.
core of my heart
Thank
for
you.
giving
Thank
such
you.
a wonderful presentation. I have not seen this is my fourth meeting today itself. Sir, one of my happiness is I am just sharing across the country today. Kedila has designed 100 digital meeting, 100, and at least 100 doctor has aligned with the one meeting. So our goal is to give information through digital media and clinic to clinic, my field force like Mr. Ravi Das along with his team. Awareness is most important for all patients. So once again saying thank you very much from core of my heart. You, Dr. Yashwant Singh Pal sir, already I know you, sir. You are giving almost 100% to the Kedila family. So Kedila family is also saying thank you very much on
Thank you.
behalf of entire team, sir. Thanks a
Thank
lot, sir.
you. Thank you. Thank you.
Now
Thank you,
I'm
sir. Should we end this session?
yeah, yeah.
Okay, sir. On behalf of my Dehradun team, I am thankful to you, sir, and also the doctor and all the audience.
Really, it's a wonderful time for us.
Thank you,
Once
sir.
again, my special thanks to Dr. Yashwant Singh sir and all participants who
Thank you.
has involved in this meeting. He has given the precious time for this wonderful session. Thanks a lot, and thank you,
Thank you.
Kerala team.
हेलो पापा भी नमस्कार। अब इसके कल बात हुई थी, तो कल आए नहीं था, तो अभी आया।